There is nothing better than a summer night on the outdoor patio at Long Neck Sports Grill. Each Long Neck's location has an outdoor patio. There are 4K TVs, so you won't miss a second of any game you want to see. And the beer selection is top notch. Nothing's better than a cold beer on a warm summer night outdoors. And by the way, if you haven't had the wings at Long Neck's, you're missing out. Get to Long Neck's, Wilder, Hebron, and Richwood, and enjoy the outdoor patio this summer. Long Neck Sports Grill. Stay late. Come often. We chat about injuries every single week on Wednesdays with one of the experts from OrthoCincy Orthopedics and Sports Medicine. We do it every single week. The great thing about OrthoCincy is they have specialists and locations across the tri-state, and they also offer walk-in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and Saturdays from 9 a.m. to 1 p.m. in Edgewood and Eastgate. You can learn a lot more at OrthoCincy.com. That's OrthoCincy.com. And remember, at OrthoCincy, you never need an appointment. Dr. Trevor Wilkes is with us this week from OrthoCincy. I want to talk first about Hunter Greene. Hunter Greene's last two starts was outstanding. 6 no-hit innings against Chicago. Good performance last week against Boston. They are skipping a start, and he is now expected to pitch this Sunday. He's dealing with hip stiffness. This is not something the Reds believe is all that serious. But let me ask you, first of all, what exactly is hip stiffness, and could this be something that might mask a more serious problem?
Yeah, it's a good question. Yeah, hip stiffness is one of these kind of vague, ambiguous terms we like to use in sports medicine so nobody knows what we're talking about. But yeah, I mean, I think the root of your question probably gets to the fact that people hear that Hunter's a pitcher, he's doing great. They think about his hips and they think, well, what's this got to do with his pitching? You know, why can't he just pitch through this? But you know, stiffness in the hips could be a factor of just some inflammation. He could have kind of overdone it, stepped wrong. But people need to remember that these pitchers, all the power comes from their legs and their trunk. So pain or stiffness in the hip could be a real impediment to his producing his power. Another really kind of interesting thing listeners might be interested in is what we've noticed in some research is if pitchers don't get their stride length, if they don't get their full push off the rubber, it's actually been associated with a higher rate of shoulder and elbow injuries. So if Hunter's got stiff, kind of tender hips and he's not getting his stride length and his power, you could be putting somebody out there that's kind of at risk for injury. But hopefully it's something pretty easy to treat.
What do you do? What do you evaluate to determine the cause?
Yeah, so most of these guys, the trainers will know what their normal range of movement is. So they'll be examining him and seeing that his range of movement is decreased, a little inflamed. He's probably treating right now with like some low impact exercise, an anti-inflammatory, and some mobility work for his hips. And I think to your follow-up question, if he just progresses in the training room nicely, his range of movement comes back, he can pass the return to sport test, then you really don't need to go any further. If it continues to bother him, then he'd be getting images, X-ray and MRI, and look for something in the joint that might be causing the stiffness.
I want to ask you about Nick Senzel, and unfortunately, it feels like when we talk about him, we're talking about injuries more frequently than we're talking about his actual production. And he had been having a good year, but now he's back on the injured list with right knee irritation. That sounds kind of vague. Is there any chance that you could pinpoint something a little bit more specific?
Yeah, again, I was sorry to hear this for Nick as well, as I'd like to see him having a good season. But yeah, hopefully what they mean by that, Mo, is that he's just literally simply having some pain on cutting, landing, running, and they just need to shut him down for a little bit. It is concerning though, because sometimes it's indicative of a problem in the joint, meniscus problems, cartilage problems. I'd like to know if he had some swelling in his joint. Sometimes that can be a bad sign. But seems like, again, kind of like Hunter, they're going to kind of treat it with some expectant observation, sort of see how he responds to first-line treatment. And if it doesn't go away, they'll need to dig deeper.
He is a guy that, unfortunately, he's been on the injured list a bunch during his career, which goes back, obviously, now to 2019. So he's been in the big leagues for a while, and yet he's just had such a hard time staying healthy. Are there things that actually might make one athlete more injury-prone than another?
Yeah, this is a great question. Kind of one of those things we bandy about in the bar all the time, talking about athletes who get hurt a lot, It's a hard question to answer. I think the way we think about it in sports medicine, Mo, is trying to break things down into factors that you can control and then factors that you can't control. Factors that you can control is looking at your nutrition, your sleep, your injury prevention programs, targeting weak spots that you work on. I mean, the Tom Brady program, right? He was famous for, dialing that in through his career. And then you look at the stuff you can't control. Genetics, maybe your ligaments are just a little bit loose, limb alignment. Some people kind of knock-kneed, bow-legged, they have spine curvature. And those are things they can't really control. But like most things in life, the truth kind of falls in the middle most of the time. But, in sports, we try to find the things that we can get an athlete to control and keep them as healthy as possible.
Let me ask you about kind of a weird case in the NFL involving Jimmy Garoppolo, quarterback. So obviously he's now with the Raiders. When he was with the 49ers last season, he had a foot injury at the end of the year and missed the rest of the season, missed the playoffs. Initially, the thought was Liz Frank injury and surgeries needed. And then the determination is made that he doesn't need surgery. He changes teams. The Raiders discover a problem during a physical exam, and he actually ends up having the surgery. And we don't know if he's going to be good to go for training camp. Let's start with the verbiage involved with the injury here. What is a Liz Frank injury?
Yeah, that's a good question. It's a weird kind of phrase. It's spelled L-I-S and then F-R-A-N-C. So the Liz Frank joint is essentially, think of it as like the arch of your foot, your midfoot. Everybody knows that the arch of your foot is kind of vital to the stored kind of push-off effect that your foot has. Those little bones and ligaments that hold them together in the middle of your foot are just, vital to the way your foot works. These days when we have these incredibly powerful athletes in, real flexible, lightweight footwear on hard surfaces, they get these twisting, rotational injuries to their foot, and they can hurt those little bones and ligaments. So that's what a Liz Frank injury is. It was actually named for Napoleon's surgeon during the Napoleonic Wars. That's why it has such a weird name. But yeah, you're right. It's it's a common sports injury. We see them a lot these days. This is a real fascinating case, Mo, because for sports fans, it really gets at the issue of when one of these athletes needs surgery and when they don't. And for me as an orthopedic surgeon, it's kind of difficult waters to wade into. Obviously the Niners doctors back in December thought that he had a low-grade injury and that it would heal naturally. I'm sure they made those recommendations, out of the best of intent at that time. But by the time he signed his contract and he came in for his medical eval with the Raiders, they probably put him through some stress tests, some stressed x-rays and imaging, and saw that it wasn't healing well. And maybe there was some gapping or the ligaments were loose, and then he ended up having this surgery. So it's a tough situation for both the athlete and the team at this point.
Yeah. Why does something like this perhaps get misdiagnosed?
Yeah, it's hard. And again, it's tough waters for me as an orthopedic surgeon because, misdiagnosed, not to push back too much on that, but can be tough. I think, anybody who's had an ankle sprain can appreciate that you can have a mild ankle sprain and literally go right back into the game with some tape. And you can have a bad ankle sprain and be out for 3 months. So these injuries all exist on a spectrum, and they don't always heal the way we think. So, obviously they did misdiagnose it because it didn't heal well. But, I think the other side of that coin that's interesting, Mo, is if you look at surgery for Liz Frank injuries, only about 80% of athletes return to the NFL at their previous level of participation. And even then their stats are usually a little lower than they were before. So the surgery itself, it carries with it some risk. And so you want to make sure that you're picking out athletes that really need it.
Let's talk about the timeline for him moving forward. Is it realistic to expect that he could start the season healthy?
Yeah, it definitely is. Looking at the surgery being done in March, typically now at this point, he's doing speed and agility, non-contact stuff. And so I think it's reasonable to think that he may be back by the start of the season. I know it's a difficult situation though, because he's not in there to start working on installing their offense and everything. and he may miss the first couple games of the season. So borderline, but it is a possibility.
All right, there you have it, Dr. Trevor Wilkes from OrthoCincy. I say this all the time. The great thing about the people at OrthoCincy, they've got specialists and locations across the tri-state, which includes walk-in orthopedic urgent care weekdays from 9 a.m. to 9 p.m. and Saturdays from 9 a.m. to 1 p.m. in both Edgewood and Eastgate. It goes without saying it's easier and cheaper than going to an ER when you have an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. Are you looking for a place to hang out outside with your buddies this summer? How about Long Neck Sports Grill? Each Long Neck's location has an awesome outdoor patio, perfect for the summertime. The beer selection is terrific, and the menu is extensive. By the way, I say it all the time, if you haven't tried the wings, what are you waiting for? Each Long Neck's location is very easy to get to, Wilder, Hebron, and Richwood. And yes, while you're sitting outside, you'll never miss a minute of the action on their 4K TVs. Long Neck Sports Grill. Stay late, come often.